Hi there, this is Dethi here at the Digital Health Summit Studio Live. I'm with Vidya, Raman-Tangella, is that correct? And she is the head of the Innovation Center of Excellence with United Healthcare. Well, thank you for coming and being with us today. You were just on a panel that was focused on caregiving and what's going on with caregiving. And so why don't you tell me a little bit about how United Healthcare, which is a very large healthcare company, what you're doing in that space today?
So, we identified that space of caregiving as a space that needs a lot of help. So, for instance, we all talk of lifestyle management, somebody wanting to lose weight or quitting smoking, and sort of providing the support and that ecosystem around them. But as my team heads in, we all we do is innovate, and one of the things that we do in order to innovate is actually spend time understanding a need from the standpoint of that, the consumer or that end user. And what we unraveled is that people need just as much help to manage life stages in addition to lifestyles. So whether it's pregnancy, where a woman is overwhelmed and she doesn't know where to begin, am I doing it the right thing? We've all been there, right? But also at the other end of the spectrum, now you're taking care of somebody who's older, where do you begin? It's a very daunting experience. So, that's how we got into it, because it was an unmet need within our populations. It's something that we heard loud and clear from our customers and from our partners, and including AARP. And so we decided to look into that space and said, okay, if we are in, our mission is to help people live healthier lives. And so we wanted to look at this need, understand what people need, and what we found is that it's not one thing they need. It's a whole ecosystem of support that they need. And so that's how we went about creating solutions for caregivers.
Yeah, it's absolutely wonderful, I think, what you're doing. And some of the studies that I've read about caregiving is that caregivers themselves can end up having their own health issues because of lack of sleep. They can't do the right diet. They're trying to care for somebody else. A lot of time they then end up having their own health issues.
Absolutely.
So it's very, I would think, kind of natural, right, to try to find better ways to support the caregiver.
Yeah, and in addition, so first of all, no caregiver labels themselves a caregiver, right? We are put in the situation, it's out of necessity, and we just want to do the right thing. But you're absolutely right. More than 50% of people have told us that they have seen their health worsen. Physical, mental, emotional health worsen through that journey of caregiving. Over a third will choose to reduce their work hours or completely quit a job in order to take care of somebody else. So absolutely. So caring for a caregiver is just as important as helping that caregiver provide care for somebody that they love.
Wonderful. Well, thank you so much for joining
My
us
pleasure.
in the studio today. I really appreciate it. And this is Dethi. I'm here at the Digital Health Summit Live Studio.